Chrissy Teigen is an amazing actress, beautiful woman, age 20 in 2005. It looks like her breasts are a little bit fuller. So I believe at this time she had breast augmentation. Her size is appropriate for her, and it was done very nice and very tastefully. Now her eyebrows start to look a little bit more arched, and her skin looks great. So I think at this time she might be getting some Botox done, get that nice round arched look. 2009, you can see her high arching eyebrows, and at this time her cheeks look a little bit fuller. Couple things. I think it's possible she had a small cheek implant put in, but it's also rumored at this time that she had some liposuction done to her armpits, or she may have had some hyaluronic acid filler. You can see one side of her face, arch of her eyebrow looks a little higher than the other, so that's common what happens sometimes with a little Botox here or there. Usually by 28, most patients, not everybody, get some sign of some wrinkles. That doesn't occur naturally, so she's keeping up well with her Botox and filler treatments. Her nose starts to look a little bit shorter and a little bit more narrower than it did before. So I believe at this time it's very possible she had a rhinoplasty done. I think it was very nicely done, very tastefully done, and it looks great. In these pictures, her cheeks look a little puffy to me. She may have had a little bit too much filler, giving her a little bit of that pillow face, which can happen when you have a little bit too much filler. But that's not a big deal, it's not to worry. I'm sure it's hyaluronic acid, and it looks like it did get slightly smaller as time went on. I think she's getting filler to her cheeks, but also now I noticed her lips. Her upper lip now looks larger than it did years ago. Obviously, she's getting filler to her lips now as well. 2017 at age 32. I do believe probably at this time she's been getting some non-invasive radiofrequency treatments to her skin. Keep it tight and from falling down. Your skin tends to fall 1 millimeter a year, roughly when you're late 20s and early to 30s. 2020 at age 35. At that time, she was open of some of the plastic surgery she's had. She claimed she had breast implant removal, and she also had buccal fat pad removal. And I think these pictures that show that, her chest does look a little flatter here. Her face looks a little chiseled. The buccal fat pad is located right here, and in the heavier person, heavier face, it can give a more defined chiseled feature and look. Eyes, it looks like they changed direction a little bit. They look like they're slanting upward a little bit, which is a little bit of a subtle change from years before. So I think it's very possible at this time she had what's called a canthopexy. Today, she's 39, more the same. She's doing great skincare, filler to her lips, and possibly a little bit to her nasolabial fold so they don't look so deep, possibly to keep that fullness in her cheeks. I think she's done a great job, kept herself very nice and youthful. This has been probably a lot of effort on her part and a tremendous investment on her part as well.